Welcome back. The National Transport Department says there'll be a zero-tolerance approach against drunk driving this Easter weekend. RTMC says there was a rise in crashes as a result of drunk driving during the last festive season. For more on this, I'm now joined by Caro Smit, the founder of South Africans Against Drunk Driving. Caro, very good Easter Friday to you. Thank you so much for joining us this evening. So we are seeing a lot of cars on the roads. In fact, the RTMC had spoken about a 30% increase in vehicle accidents caused by drunk driving in the 2024-25 festive season. The Transport Minister, Barbara Creecy, has come out and saying that we need to review strategies with regards to clamping down on drunk driving. But she speaks of a very weak liquor legislation. Do you agree with that viewpoint?
You know, our liquor laws in terms of drunk driving are very, very good in South Africa. So that is not the problem. The problem is that we're not doing enough testing and there's not enough prosecution. So of the people, you know, if we think there's 13 million drivers on the road, we should be doing 13 million tests a year, but we're only doing about 150,000. And then of those 150,000, only between 2 and 7% actually are convicted. So that's a problem. People drink and drive in South Africa because they know they can get away with it.
Speaking about that, I mean, she also speaks about the culture of drinking and driving not being discouraged. You speak of the large disparity in terms of how much we should be testing versus how much we are testing. What have you seen are the trends with regards to why we're not testing enough?
You know, I'm not sure. It's one of the things we're working with the Minister of Transport and with RTMC on a project called Project Edward South Africa. And they have been asking us NGOs, because a lot of us are very, very experienced and have been working. I've been working for 20 years with a lot of international training on road safety. And so we're asking for best practice to be actually brought in, for evidence-based practices. So what we should have actually in situations like the Easter weekend and over Christmas is we should have traffic courts available 24 hours a day, like they did in the World Cup, so that when people are caught for drink driving, they're taken to court immediately to these traffic courts. They are sentenced, their licenses are suspended, they get a criminal record, and that is publicized very widely, so that people know that drink driving is taken very, very seriously in the country. But at the moment, people drink then drive because they know they can get away with it, because most people get away with it. So that is one of the things we've been asking the minister to please get more testing equipment. So the screening breathalyzers in more of the traffic officers and the policemen's vehicles. And then more of the evidential breathalyzers, the ones that go, you know, to court, allowed to go to court. We need more of those. So to save lives, and to save money, we have to spend a lot of money. And by spending the money on those sort of things, the breathalyzers, we will then save money in terms of, you know, the cost to the government and the country. But more importantly, we'll save lives, and we'll save injuries, and we'll save the most incredible heartache and damage to families and mental health.
I mean, Caro, you speak about best practice and what was already done during the World Cup with the traffic courts. Are there countries that we could look to who have some of those best approaches in terms of how they've tackled drunk driving and we've seen it actually work?
You know, most of the first world countries, people, what they really push very hard for is the very swift sentencing. So getting them sentenced within a week. If you look at somewhere like Canada, if people are caught drink driving, so it's not called drunk driving anymore, because any alcohol affects your driving skills. So if someone is caught drink driving in Canada, they're over the legal limit, and they can go straight to jail, or they can have their vehicle confiscated. So a lot of the countries do absolutely immediate repercussions because they're just saying it's unacceptable. And so in those countries, the incidents have gone down dramatically, and the death and injury rates have gone down. Whereas, I mean, we're sitting at like 57% of our deaths on the road, deaths and injuries, are because of alcohol. So not only the drink driving, but also the drink walking, because it's seen as okay. People boast about it. Oh, I was so drunk last night. I can't remember how I got home. And as you said, we've got this terrible culture of being proud of being drunk, of being proud of driving under the influence. And that has to change when people see that this is a criminal action, when people start getting criminal records and start having license suspended. And then suddenly, what happens, like happened in Australia, if someone is over the limit and they want to drive, their friends say, no, 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 you mustn't drive home tonight. You could get caught. You could have your license removed. You could go to jail. You could. And so the friends start stopping them because the only thing that works to change behavior is if people are afraid of the financial and the legal repercussions of their actions, so that it hits their pocket and it hits their criminal record. No one wants a criminal record because
Of
that
course.
affects your chance of working. But driving under the influence is an incredibly criminal and selfish action.
And changing that behavior shouldn't only be with all the visibility that we see during the festive season, during the Easter time. It certainly should be something that we are seeing on our roads all the time, every weekend, for people to understand that this is a way of life, and for such behavior, and the culture then changes around drunk driving.
Sure, but not all weekend or every single day of the week. I mean, if you think on Monday morning, if someone has been watching soccer matches late into the night, they probably over the legal limit on Monday morning, because it takes a long time for alcohol to be removed from your system. So people think, if I have a whole lot of alcohol and then I have a sleep and a cold shower and a cup of coffee, I can drive in the morning. But many times you over the legal limit because so for example, if someone has four quarts of beer, for the 750 beers, that's 4, 8, 12, 16 units of alcohol. It'll take them 16 hours before that alcohol is out their body. So that's why we don't talk about drinking and driving. We talk about drinking then driving, because you can be way over the legal limit from the day before.
What are some of the challenges that you face as an NPO? I mean, you speak about the collaborations that you have with the Department of Transport, but what are the challenges that you face in averting drunk driving?
Some of the main challenges are, trying to get government to implement these best practices. That is obviously one of the challenges. The other big challenge is a lack of finances in the transport department for them to roll out these different things that work. And for us too, the NGOs, we obviously financial support is very low, especially if someone trying to stop drunk driving or drink driving, because people say, oh, we all like to drink then drive, so why should we support your NGO? But the other problem too is that people, when somebody dies in a crash, remember, these are preventable crashes, they're not accidents. When somebody dies, very often what the family says, they say, oh, this was God's will, so therefore I'm just going to leave it. I mustn't be angry, I mustn't do anything about it, or it's Allah's will. These are not God's wills. These are preventable crashes. These are something we should all be standing up and say, it's absolutely unacceptable. We need to stop this carnage, because it really is unacceptable carnage. I mean, in the last 10 years, we've lost 140,000 people on the roads. And half of that is because of alcohol. But apart from the 140 who we've lost on the road, if you can times that by 20 to 50, the number of people who are injured. And remember, if someone especially is severely injured, say it's a breadwinner, the wife then has to stop working because she's got to support her husband, look after her husband. The family is thrown into poverty. The children, they have to go into social grants. It's very hard to get education. It's hard to have food on the table. So it's a very, very large problem. So the whole thing we say is connect the dots. This is an enormous problem that goes way beyond just the Minister of Transport and it goes into the fiscus. What about health? You think of these doctors and nurses who in the emergency department who are just seeing this total carnage coming in from crashes, from gender-based violence, from stabbing because of alcohol abuse. So these are all things we need to really work very, very hard to stop this abuse at the source, and by actually once again implementing what World Health says works, stopping alcohol advertising, bringing the drinking age up to 21, and there are a lot of different things that we can do to bring down our crash rate.
Right. With that said, Caro, where do you see the landscape changing in the next 5 to 10 years with regards to legislation, one, and public perception, two?
You know, our legislation is some of the best in the world. So if you look at what World Health say, they're very happy with our legislation. The only thing they say we need to change in terms of drink driving is that for novice drivers, so whether the person is 18 or whether they are 40, for the first year after they get their license, they should not be allowed to drink any alcohol, or otherwise it must be less than 0.02. Because in that first year of getting your license, your chance of having a crash and dying are very, very high. So it's obviously much better if alcohol is not added into the mix. So World Health say, bring that down. And if we bring that down, they're very, very happy with our drink driving laws, as long as there is a lot more enforcement and testing.
All right, Caro Smit, thank you so much for your time. It certainly does take a collaborative effort in order for us to reduce those carnages.